Assalamu alaikum. The last part of the chronic diarrhea lecture, we were talking about causes of chronic diarrhea in children. وصلنا لحد الكوميك protein allergy. Allergy usually starts when children are given milk products. Typically, symptoms are vomiting, diarrhea, colic, and constipation may occur. Other representation are wheezes, cough, atopic eczema, and behavioral changes like irritability, crying, and milk refusal. A challenge with milk-free times may have a good indicators. يعني نسوي له challenge نوبات من نقطع الحليب يشوف الطفل يرجع normal, active, healthy, suckling well, and may have good indicators. However, histopathological examination and non-diagnostic فيبقى challenge هو الوحيد اللي أشخص به. Toddlers diarrhea called the chronic non-specific diarrhea of children. وهذه حكينا عليها كone of the types of diarrhea بالمحاضرة الأولى. It is a common problem occurs in children mainly above 2 years of age. ويجيك الطفل كلش healthy و normal growth ويقمز و active, very active. Investigations كلها normal, growth parameters are normal, but frequent bowel motion. And it is a benign condition. Usually the children have no failure to thrive and they present in a good nutritional state. Abdominal pain may be present in a minority of them, and the stools are foul smelling, watery, and contain mucus with undigested vegetable materials. The parents are likely to report a short mouth to the anus transit time. يعني يقول لك أول ما ياكل عشان تطلع بطنه، بس تشوف النمو مالته زين والانفستيجيشن كلها زينة. وغالبا ما يكون عندهم family history of the same condition بالكبار اللي نسميه irritable bowel disease. نجي إلى كوز كلش مهم اللي هو giardiasis in children. Giardia is one of the nastiest parasites in children. Giardia, one of the causes of very familiar causes and common causes in our country developing because of the poor sanitation and contamination. Giardia lamblia is a flagellated protozoa that infects the duodenum and the small intestine. Wide range of clinical manifestations result from asymptomatic, acute, and chronic diarrhea, even malabsorption status, just like the celiac disease. Infection is common in children, more common in children than adults. Etiology يمكن بهذا السلايد موجود شوية معلومات عن نقراها ونحاول نستفيد من عندها. عن الجيارديا لامبليا، هذا شكلها الجيارديا، تقريبا عندها فلاجيلا فلاجيلا وتيبيكال من يشوفها اللاب examinist. Clinical manifestation, incubation period is around 1 to 2 weeks, and the child may be asymptomatic or have acute watery diarrhea, maybe fever, nausea, and anorexia. The stool initially may be profuse, watery, and later becomes greasy and foul smelling and may float, constipation, or normal bowel motion. Signs of fat-soluble vitamins deficiency, malabsorption of sugar, fat, and weight loss. How to diagnose? الجيارديا usually more serious than Entamoeba histolytica لأنه الإنتاميبا lives where in the colon, but the giardia lives in the small intestine higher up ومن النوع اللي adherent تلزق، يراد لها علاج intensive therapy. منو اللي أخطر؟ الانفكشن لما تصير بالكولون ولا لما تصير بالsmall intestine? Definitely in the small intestine will lead to more serious because she's going to compete you on your food. فراح تبدي تنافس الإنسان على الأكل مالته وراح تبدي تسوي في chronic illness and malabsorption state. Repeated fresh stool examination أو samples examination for the trophozoite, the cyst, and giardia antigen in the stool or duodenal fluid. Aspiration or biopsy of the duodenum or upper jejunum. Blood count is normal usually, no eosinophilia and giardiasis. Treatment metronidazole 15 إلى 25 mg per kg per day divided doses for 5 days. Furazolidine 6 mg per kg per day divided doses for 10 days. أو tinidazole 30 mg per kg per day single dose therapy. What about cystic fibrosis? It is an autosomal recessive disorder. Most patients have respiratory symptoms as recurrent pneumonia, and adenoids. Those patients have pancreatic insufficiency which leads to diarrhea with greasy stools. يعني المشكلة وين هو بالترانسبورت مال كلورايد ايون، وهذا الكلورايد لما يصير بالسبيوتم بالميوكس ممبرين مال كل إنسان أنا أشبهه بعمل النظافة، فيجيب وياه ووتر فيغسل، فإذا كان اكو abnormal transit أو transport of the chloride فتبدي تصير الميوكس ممبرين السكريشنز مالتها very thick و stagnation راح يصير overgrowth مال بكتيريا and gradual damage to the integrity of the mucous membrane. وإحنا نعرف كل جسمنا مبطن بالميوكس membranes ف it affects mainly pulmonary and GIT اللي هو أكثر شيء pancreas و pancreas ending up with non-functioning pancreatic gland تبدي بالإكزوكراين and later on بالإندوكراين part of it. فأكثر شيء أكو chronic cough أكو chronic diarrhea and malabsorption and every part of the body lined with the mucous membrane will be affected. Failure to thrive genetic diagnosis and the sweat chloride test are main investigations. نسوي لهم sweat chloride test لأنه it is autosomal recessive inherited disease راح تشوف more than one sibling in the family could be affected. فويا كل عائلة اللي عندها أكثر من طفل عنده repeated chest infection with chronic diarrhea يعني لازم أفكر هذا ممكن cystic fibrosis and I should send him either for genetic diagnosis واللي هو صعب ما موجود عندنا بالعراق فممكن ندز sweat test. Acrodermatitis enteropathic and autosomal recessive disorder as well presented with perioral rash, chronic diarrhea, recurrent infection and napkin rash resistant to treatment. راح تصير الراش راح تصير around all the orifices تبدي red and turning into black وننطي احنا treatment but there is no use and no response because the body is in demand for zinc. Usually starts at the time of weaning and tint red hair with alopecia. Diagnosis serum zinc is in the white feces or in the blood is very low and the treatment is with oral zinc and should continue on the zinc supplementation. This is typical acrodermatitis enteropathica. Look at the orifices, كل الorifices around which acufed erythematous patches وبعدين turning into black. Chronic diarrhea of older children common causes يمكن هنا شوية صعدنا post-enteritis syndrome وراها celiac disease, lactose intolerance, infections, Giardia and HIV, irritable bowel syndrome and inflammatory bowel diseases. post-enteritis syndrome حكينا عنه بالمحاضرة الأولى post-enteritis syndrome وحتى بهاي المحاضرة بالبداية هم حكينا عن mechanism. Persistent diarrhea after gastroenteritis is caused by continuing infection, further infection, carbohydrate intolerance, post-infection malabsorption syndrome, and usually subsides. But severe cases may persist to longer periods. Stool analysis and stool cultures should be done. Treatment of the cause is usually beneficial. What about pseudomembranous colitis? Also called antibiotic-associated colitis or Clostridia difficile colitis, it is an inflammation of the colon associated with an overgrowth of the bacterial Clostridium difficile. This overgrowth of Clostridia difficile is most often related to recent antibiotic use. لذلك واحد من الأسئلة اللي كلش مهمة بكل chronic diarrhea هل الإنسان ماخذ antibiotic؟ لا. هذا applied on the children as well. Stool sample, there are a number of different stool sample tests usually to detect Clostridia difficile infection in the colon. A blood test, these may reveal an abnormally high white blood cell count, leukocytosis, which may indicate pseudomembranous colitis. Colonoscopy and sigmoidoscopy, signs of pseudomembranous colitis, raised yellow plaques, lesions, as well as swelling. Treatment is with metronidazole. Orally لازم نتذكر treatment هو flagyl orally or vancomycin can be given orally as well but it should be oral not IV. Inflammatory bowel disease, this is of two types, Crohn's disease and the ulcerative colitis. 20% of cases present under 20 years of age. It has intestinal and extraintestinal manifestations. Clinical picture هي diarrhea, abdominal pain, growth retardation, weight loss, anorexia. Colonic Crohn's disease may be clinically indistinguishable from ulcerative colitis, with manifestations that include the following: bloody mucopurulent diarrhea, cramping abdominal pain, and urgency to defecate. يعني اكو فرق بين الالسرتيف كولايتس والكرونز. الكرونز ممكن يبدي من بداية الجي اي تي الى نهايتها from the mouth or oral cavity to the anus، بينما الالسرتيف كولايتس من اسمه confined to the colon. Usually the lesions of the Crohn's are transmural, while the ulcerative colitis تشمل الممbrane mucosa and the submucosa. Perianal involvement in Crohn's disease is quite common and may produce the following simple skin tags, fissures, abscesses, and fistulas, painful defecation, bright red rectal bleeding, perirectal pain, erythema, and discharge. Examination: growth is impaired, intermittent fever, tachycardia, mouth ulcers, anal tags, arthritis, erythema nodosum, pyoderma gangrenosum. Tanner staging is important، يعني أنا مود أحدد sexual growth of the child. وطبعا الانفستيجيشن تتضمن البلد complete blood count, anemia, ESR كلش عالي, C-reactive protein usually positive, elevated, hypoalbuminemia. Imaging studied a single contrast upper GI tract radiological series with a small intestinal follow-through sometimes done. وما ننسى نوبات. Why نوبات؟ extra-intestinal manifestation can present years before the GIT. نوبات تدخل بالديفرنشال diagnosis POO, arthritis, anemia, joint manifestation. كل هذا ممكن يدخل يعني سنين يبقى المريض يشكي من هاي الشغلات complaining, and then later on GIT manifestation and diarrhea will start to show up. Diagnosis is by endoscopy, colonoscopy with several colonic and terminal ileal biopsies is considered the standard diagnostic procedure. Upper endoscopy or esophagogastroduodenoscopy should be part of the first-line investigation. Video capsule endoscopy is increasingly being used to evaluate for the small bowel Crohn's disease in children. Step-up approach: patients with mild disease are treated with preparation of 5-aminoglycoside. يعني هذا هو الفيرست لاين مانجمنت، يعني ما نبدي رأسا بالسترونج treatment، يعني أبدي بسمبل وأعطي antibiotic and nutritional therapy. If there will be no response, we can start by steroids. We can start by corticosteroids, and then after the patient getting improvement, I can add some immune modulator therapy or cytotoxic drug. And the surgery is considered when the medical therapy fails. Indications for surgery include the following: intractable disease with growth failure, obstruction or severe stenosis, abscesses requiring a drainage, perianal fistula, and intractable hemorrhage and perforation. Thank you very much.